Healthy aging is more than just the absence of disease. It's about people taking care of themselves, good nutrition, physical activity, engaging in volunteer activities, and people engaging with other folks to enjoy life.
The foundation decided to focus on healthy aging because, frankly, nobody else is doing it. And we looked at the landscape and we said, you know, this is something that somebody needs to do something about. And this population is growing, and they have a whole slew of issues that they're grappling with.
By creating the Tufts Health Plan Foundation, we're able to create a thoughtful pattern of giving that can actually affect positive changes in the community.
It's about people coming to terms with what they can and they can't do, and participating in ways that make their lives full.
One of the things that the foundation focuses on is purposeful engagement. Engagement of older adults with their own wellness and participation in the community.
I'm Dora, and this is Boots. I personally love to read, and I think if you get children into reading at the very first part of their school life, you've hooked them for life.
One of the activities that we really promote are some intergenerational programs where adults and children do activities together and learn about each other.
What do you think they're going to do?
Hike up the mountain.
Hike up the mountain. And you can see that they want to learn, they want to know what words are. Seeing this little mind come alive, and with no use of a television. It's just through reading that they get it.
It helps to alleviate social isolation in that it gives the individual a purpose to get out of their houses, connect with one individual, and really affect that individual's lives.
The Reading Partners program not only improves their overall well-being, but I think we would argue that it helps people live better longer.
Oh, you are wonderful, Emily. You're doing so good. And to see that this child is going to turn into an absolutely fantastic adult when they get older. And I think part of that might be my little tiny, tiny bit of responsibility.
One of the wonderful aspects of the foundation work is helping to support programs that promote healthy lifestyles.
All right, 20 seconds left. Big stretch. Feel a stretch in your hip. Good.
I was in the hospital with congestive heart failure, high blood pressure, and blood sugars running way above normal. And the doctor told me that if I didn't exercise, she's going to quit working with me.
Kit Clark's Fitful Life. It helps people to gain strength, learn how to balance, walk safely up and down stairs, and all of the things that are necessary to really be stronger in your older age.
So we're going to stretch, 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 stretch. Good, now bring it back. They're getting a better understanding by feeling how their body's supposed to move. The less likely they are to fall, the less likely they are to hurt themselves.
When I first came here, I could get my shoulders about like this. Now I can do just about anything I want to.
With this people, it's really just about function. So a lot of people may say, I want to be able to just play with my grandkids, or I don't want to feel like I always need to rely on somebody else.
I no longer now tire out walking upstairs. So a huge change in how I feel and what I can physically do. I think the program has basically saved my life.
I see the foundation taking an increasingly central role in encouraging all of our society to deal with aging as healthy aging rather than aging as a way in which people are limited in their lives.
I came down with lymphoma. I just couldn't drive back and forth to the hospital, and that was when I said, well, that was it.
We fund a program, ITN Greater Boston, that provides transportation for older adults.
One of the things that aging does, which is sad, is that seniors lose their autonomy, they lose their ability to be the way they used to be.
I felt like I left my right hand somewhere. I felt betrayed.
When you give them a means to continue to live on their own terms, it's extremely empowering.
They still can do the things that they normally have done. Get to the doctors, go to the mall, go to the hairdresser, go to the bridge game, but it's just done in a little bit different way. They're just not driving themselves anymore. They're getting a ride.
I enjoy getting out of the car, taking the arm of the individual that I'm transporting and walking him or her to the door, and sometimes inside and sometimes upstairs, depending on what they need.
I feel like I have a member of the family with me. They're very friendly and we get to know each other. I don't have to call anybody for a ride, or I don't have to call a cab for a ride. I feel very independent.
By having the Tufts Health Plan Foundation, Tufts Health Plan is able to be an even better corporate citizen, an even better member of our community, and an even better health plan for all of our members.
I'm so optimistic that as people age, they're going to embrace some of the aspects that help them to live long, healthy lives. And my hope is that through the programs and services that we provide, the partnerships that we've developed, we're going to be able to change the culture of aging in both Massachusetts and Rhode Island.